So thank you everybody. Um, Today we will speak about the case of Austin. Austin is a golden retriever, intact male, 2 years, weight 28 kilos. Austin was presented for evaluation due to behaviors consistent with persistent stress, and his stress-related behaviors lead to weight loss and prevent proper weight gain. And the onset of stress was associated also with the presence of unformed feces. So the case history. Austin lives in a breeding facility, and he alternates his daily routine between the kennel environment and a family's office setting. He is an active stud dog, and he mounts only in solitary context. Austin is compliant with routine vaccination protocols and parasites prevention treatment, no history of significant past illnesses, and he is not taking currently any kind of medication. Austin has a normal sleep pattern, normal exploratory behavior. He does not destroy or steal objects. He does not engage in pica or coprophagia. And no inappropriate elimination has been ever reported. Austin is taken for walks for a total of 2 hours per day, morning and afternoon, both on leash and off leash. And he completed a 3-month training program starting at 4 months. And is a good way to play. He plays properly with other dog and shows no sign of aggression. And he has never displayed any kind of aggressive behavior toward people or other dogs. Austin, at 10 months of age, experienced a significant fear reaction, and suddenly he heard the intense barking of a highly agitated dog housed in a nearby kennel, and the other dog repeatedly tried to escape confinement, producing loud rattling noises that contributes to a marked fear reaction in Austin. And since that episode, Austin has begun to show generalized stress-related behavior, both in familiar and unfamiliar situations, along with weight loss and persistent diarrhea. And his stress condition, as said before, leads to weight loss and prevent to weight gain, losing body condition. The owner described Austin as frequently agitated and reactive. He is fearful of loud noises, he pants frequently, he hides, he trembles, and he is often looking for physical contact. And he also shows environment-dependent mood fluctuation with a marked increase in novel or unfamiliar situations. In this video, you can see Austin freezing behavior in the office setting. Austin's entry in the office environment, which was previously known to him as a puppy, and he showed a freezing response before gradually relaxing.
Dai, domenica incassate 10:30. Ok. Grazie a te. Ciao. Ciao, ciao.
Allora, aspetti che la faccio parlare con Paoletta. Prego.
And comparable behavior was also observed in other familiar contexts. Austin is more confident when he is with other dogs, but He's always agitated and hyper excitable.
Austin, bravo amore. Fai un po' seduto, vediamo se lo sai seduto, bravo. Bravissimo, sei insieme agli amici?
She's the owner.
Oh, mio bambino.
And he also displayed marked startle and fear responses to the sudden arrival of unfamiliar people or when a door is slamming. And in this situation, he can vocalize, but barking for Austin is not so frequent. About the nutritional evaluation, Austin is 28 kilos, and the body condition score is 3. And since winning, Austin had been fed with pro-plant sensitive digestion medium puppy, and he remained on this diet until the 10-12 months of age with the fearful event, when he started to show episodes of diarrhea and signs of stress-related behaviors. And so following the onset of this clinical manifestation, Austin was taken for consultation and underwent to an examination by a veterinary nutritionist. So a complete clinical examination, a full set of laboratory tests were performed with complete clinical chemistry panel, complete blood count, capillary protein electrophoresis, complete urine analysis and urinary chemistry. ELISA test for JARD was performed and resulted negative. A fecal parasitological examination was also negative. Serum canine trypsin-like immunoreactivity was within the normal range, and vitamin B9 and B12 levels were within the normal limits. So the nutritionist decided for a diet, and at 12 months of age, gastroenteric diet was prescribed, consisting of gastroenteric purina wet and dry, fortiflora, honey, flaxseed oil, and purina propran relax plus. Austin is fed twice daily, and his appetite is reported as excessive, and the ingestion rate is rapid. Meals are provided on a regular schedule, and no food is left available ad libitum, and the drinking behavior is described as normal. So this diet was prescribed to address chronically soft stool and to promote weight gain. In fact, after 1 year, Austin gained 3 kilos, and the episodes of diarrhea have been significantly reduced, but no reduction in the symptoms referable to a persistent state of stress were observed. So a behavioral assessment was conducted at the University of Milan, and during the clinical examination, Austin showed signs of stress-related behavior. So we decided for a behavioral modification consisting of ignoring undesirable behavior, so stress-related behavior or barking when it happened, and reward desirable behavior. And also we suggested the use of the more stable dog in potentially critical situation. No medication was prescribed. The diet with purina gastroenteric was maintained, fortiflora was maintained, calming care was added to the diet, and no other feeding recommendation was given. The owner was asked to fill out a behavioral assessment questionnaire before starting the probiotic, and every 5 days. And at 6 weeks, the questionnaire should be completed again to see if there were any changes. Play behavior, inter-dog, stranger-owner aggression, hyperactivity, panting, trembling, hiding, attention-seeking, fear of loud noises or gastrointestinal signs, mood instability, and repetitive behavior were observed in this questionnaire. And we evaluated if they were decreased or stable or increased. So the follow-up. After 6 weeks, Austin maintained the 3 kilos previously gained, but also he gained other 2 kilos since starting calming care, and fecal consistency remained normal throughout the period, and also his overall health status remained unchanged. A notable improvement in behavioral stability within the breeding facility and in the office environment was observed. Austin has improved when he is alone and when he is with the other more stable dog. His generalized stress emotional state has shown a partial improvement. So when Austin is exposed to novel stimuli or to the sudden arrival of individual, Austin presents increased behavioral stability. It does not exhibit agitation and shows more regular and controlled behavioral responses. Also, during this period, Austin also completed a mating. Previous mating resulted in very small litters, as his intestinal dysbiosis had negatively affected fertility, and the most recent mating produced 6 puppies, indicating an improvement in their reproductive performance. So, in some form of stress emotional state, when psychological signs are accompanied by somatic manifestation, as in the case of Austin, the use of a supplement capable of modulating both components, psychological and somatic, represent an ideal management option. And the simultaneous reduction of both, so stress-related behavior and gastrointestinal signs, further support the need of address these 2 dimensions, which are organic and behavioral, in parallel. And furthermore, when the product is not a pharmaceutical agent, it can be given easily and safely by the owner, and can also offer additional advantage of being fully compatible with the introduction of a pharmacological treatment if needed. And so, to conclude, the take-home message is that the patient must always be considered as an integrated organism in which body and mind constitute a single functional entity, and behavioral science should therefore be always interpreted in the broader context of the animal's overall physiological condition, and a comprehensive evaluation of the patient, in this case Austin, is always required. I want to thank you, I want to thank Purina, I want to thank Guido Poncini, Bianco Spino, but overall I want to thank Austin. Thank you very much.
Thank you very much. Thank you very much, Clara, for this nice case report. And now we'll give the floor to Marta Amat. So let me first introduce her. Dr. Marta Amat is a veterinary behaviorist and researcher at the Autonomous University of Barcelona. She holds a bachelor in veterinary medicine, a master's in veterinary research and food sciences, and a PhD from also the same university. She has been a diplomate of the European College of Animal Welfare and Behavior Medicine since 2008, and she's the head of the Clinical Ethology Service at the UAB, Veterinary Clinical Hospital. She also conducts research, specializing in clinical ethology and animal welfare. So welcome her to stage, please.
Thank you. Thank you so much. Thank you, Miguel. Thanks, Purina, for inviting me. So I have two challenges, okay? The first one, to stay still. It's a more difficult one. The second challenge is to give this short talk after this great previous speaker. So I'll try to do my best, okay? Let's go. So I'm going to talk about 3 clinical cases, but instead of explaining in detail the cases, I'll try to emphasize some interesting elements of these cases. So this is the plan of the talk. I will briefly review some aspects of stress-related problems. Then I will present the objective of the study, how we did it, the main results, and of course, I will finish with the discussion. As you all know, the prevalence of stress-related problems is very high. You can see a couple of studies. One study done in Finland with 14,000 dogs, a lot, you know, and the other one done in Japan with 2,000 dogs. In both cases, the prevalence of behavior problems is very high, 72.5% and 86% respectively. And in the majority of cases, these problems are related to stress. Obviously, the consequences are very negative. Dogs' welfare is clearly affected. Second, these problems affect the quality of the bond between family members and the dog. And also, these problems also have a negative impact on the owner well-being. You know that several strategies are available to address this problem. And in the majority of cases, we apply a multimodal approach. However, the behavior modification is the key element of the treatment. In addition, we can apply management guidelines in order to improve the owner's handling, to improve the environment, to optimize the level of the stimulation of the dog receive. And in some cases, we can use products that enhance resilience to stress, such as the probiotics. And in this talk, I will specifically talk about calming care, a probiotic. Okay, what was the aim of this case reports study? To evaluate the effectiveness of calming care in patients with stress-related problems. And at this point, I would like to emphasize or to review some situations, some challenges we face, or I would say we suffer, when doing clinical reports. The first challenge is to decide which dog or dogs are included in the study. So you might think, well, having a referral practice, this is not a problem. But it is a big problem. Why? Given the severity of our patients' conditions and the need of multimodal approach, multimodal treatment, given administering a probiotic alone was not considered ethically appropriate. So what we did? We enroll dogs owned by veterinary students that, of course, met the inclusion criteria. The second challenge we face is the high variability between cases. Environments, routines, diets, behavioral profiles could be very, very, very different. So what we did was establish, of course, an inclusion criteria, trying to reduce this high variability. So we included dogs of the same sex, 3 females. They live in a very, very similar environment. They were not taking probiotics, other supplements, or treatments. They didn't have any medical disease. They had the same behavior problems. And a very important thing, they had a very similar diet. I mean, they were fed dry food. And second, the diet was unchanged for at least 6 months prior to the study. And the third challenge we face sometimes when doing this kind of clinical cases is that we don't have control group. So what happens if we have a positive response? How do we interpret this? Maybe the treatment is effective. Maybe the improvement occurs due to other reasons, other strategies implemented, just the passage of time. Or maybe there is a placebo effect that you know that is very common, even when we have a control group. So to improve this, or trying to improve this, we did a couple of things. One, we used a validated tool to assess potential behavior changes. Second, we didn't apply any other measure, any other strategy. Okay, and here we can see how we did the study. We interviewed the owners, so we did a consultation, okay? And also the owners had to complete 3 CBARCs, okay? Canine behavior is a very long name, CBARCs, yeah. Specifically, the sections related to stress, number 2, 3, and 4. They had to complete the CBARC before starting the administration of probiotic, 3 weeks after, okay, and at the end of the study, 6 weeks after. And here you will see the protagonist. Here we have Lila, Mel, and Zua. Lila is a crossbred, 12 years old, neutered. Mel is a multiple dog, 5 years old, neutered as well. And Zua is a Belgian Shepherd dog, 7 years old, and non-neutered. All of them, all of the females, had the same or very similar behavior problems. All of them exhibit fear-related problems towards strangers, towards other dogs, and towards some loud noises. And now we move on the results. And before analyzing the questionnaire, the ZBARCs, remember, I asked the owners their impression. In other words, if they believe that behavior of dog was better. In all cases, the answer was no. That's life, you know. Sometimes we're lucky, sometimes we're not. But please have a look the next slide. You have a look the next slide with some of the male results is a female with the most severe fear problem. You can see some, sorry because it's in Spanish questions, but you can see some questions at time 0 before starting the probiotic, and the same questions at time 6 at the end of the study. I have marked the questions where the score decreased, meaning that the problem is less intense or less frequent. And when we compare the total score at time 0, before starting the probiotic, with the total score at time 6, at the end of the study, we observe a 27 reduction in score. So remember that the owners said that they didn't observe any change. So it's very important to avoid, or at least to reduce the owner's subjectivity and to minimize not only the placebo effect, but only the nocebo effect. Remember, the nocebo effect is the opposite of placebo effect and can occur when the negative expectations may influence the owner's perceptions. And they think that the treatment is not working, even if real changes is occurring. So that's why it's very important to use a validated tool to assess these potential behavior changes. In the other dogs with a less severe fear-related problems, we observe between 4 and 13% reduction in the score, or improvement, we could say improvement, okay? And a very interesting thing was, at least from my point of view, that several changes were already evident after the third week of administration of calming care. And now, let's move to the final section, the discussion. And here I would like to finish with this question. Yes, did we obtain the expected results? Let's see some points before to answer this question. Remember, as I said at the beginning, that in the majority of cases, a multimodal approach, a multimodal treatment is needed. And remember that the behavior modification is the cornerstone of the treatment. In this study, we only use a probiotic. Second, in our study, Mel, Zua, and Lila exhibit a chronic stress-related problems, a chronic fear-related problems. And all you know that, in general, it's more difficult to solve a chronic problem, and we need a lot of time. And third, remember, we have discussed during the background the main limitations that we face when doing these case reports: sample size, the lack of control group, the high variability, and so on. But in addition, we have to consider that there are several factors that could influence in the probiotic effectiveness. Some of these factors are related to the product, to the probiotic. The type of a strain, the indications, the quality of the product, but other factors are related to the animal. And I will very, very, very briefly comment some dog-related factors. For instance, in relation to the sex and neuterity status, we know that in different species, pigs, mice, and rats, for instance, the effects of probiotic vary by sex. And it's very interesting because in several studies, the effects were greater in males. Very interesting. And another thing is that, at least in dogs, neutered dogs have different composition in the microbiota than non-neutered dogs. And of course, this may influence in the response to the probiotic. Second, the age. The age is a very, very important factor. And according to this recent thesis, age modifies the compositions of microbiota, but also the profile of, a very difficult word for me, short-chain fatty acids. Sorry. For instance, we know that older dogs have lower levels of butyrate. And, for instance, butyrate modulates key neurotransmitters such as serotonin, GABA, and dopamine. And finally, just very briefly, in relation to the diet, again, and you know very well, that the type and amount of fiber, protein, and carbohydrate can modify the composition and the function of microbiota, another difficult name for me. And of course, again, this may influence on the response of probiotics. A couple of examples. Raw diet, that it's very popular, at least in Spain, and is higher in protein and lower in fiber and carbohydrates, produce greater changes in microbiota. And in this other study, the authors compare the composition of microbiota in dogs fed dry food with dogs fed raw diet. And they observed that commercial dry food, commercial dry diet, produce more butyrate. And remember, the role of this short-chain fatty acid in the gut-brain axis. So, we come back at the question, okay? Did we obtain the expected results? Well, considering or having into account all the previous aspects discussed during this talk, the answer is a big yes, okay? Although, of course, of course, further research is needed because we need to learn a lot about macrobiota and the macrobiotics, probiotics. Thank you so much.
All right. Thank you very much, Marta, for this excellent presentation. You nailed it. You said short-chain fatty acids very well. Okay, good. So now it's time for lunch. But before you stand up and go there, I have to remind you that it's downstairs, the same place that we had dinner last night. I also want to remind you that we have the Thank You Beds experience, immersive experience. That's just downstairs as well. If you have some spare time after lunch or before lunch, you can go there and play with it. It's a very great experience, I can tell you. That said, thank you very much. See you after lunch. We come back at 2:15.